All right, so let's go on. Study designs. First thing first, what we need to understand about study designs is what are study designs? Remember, we are doing our research. We've looked at the procedure, the steps that you have to take for you to carry out a research. And we said the first thing is you need to make sure that you have got a clear research question. And then from the research question, you also look at other literatures that people have written about it. So that is literature review, and then that is going to help you to gather data that will direct you or help you in the research that you are going to do. So study design is a specific plan or a protocol for conducting the study, and is going to allow you as an investigator to be able to translate the conceptual hypothesis, the idea that has been put up. You want to take it now into something operational. You have got an idea, okay, someone has, let's say we want to research about something. The thing that you're about to research about, you are not the first person. There are many more people that have done it. So some of them, of course, have not been concluded on, so they are just ideas. So there is an hypothesis, and then now you want to be able to translate that hypothesis into something that is operational, something that now can be, let's say, confirmed, so for you to be able to use. So that is a study design, a plan for conducting the study. Now, depending with the type of research you're talking about, you have got different study designs. Remember, I've got the qualitative research and the quantitative research. Quantitative, you are dealing with numbers. Qualitative, really no numbers there. So some of the quantitative research designs, we have got descriptive, correlational, experimental, and the quasi-experimental. Qualitative, you have got a phenomenology, grounded theory, ethnographic, the case study. So if we start with the quantitative, the one we want to deal with numbers, is a study design which are structured methodologies used to collect and analyze numerical data. Okay, let's say for example, how many people are affected by a disease in a place. Such is going to be a quantitative study design. So these ones will help researchers to identify the pattern, relationship, and the trends in a systemic way. So for the quantitative research designs, you have got experimental, the quasi experimental, and non-experimental. For the non-experimental, this is where we have got descriptive, correlational, and then the predictive. Okay, again, when we're talking about the study designs, as you saw earlier, so we can divide the quantitative into two big ones. You can see there is the descriptive, the experimental. Okay, so those two, descriptive and experimental. But of course we can just say experimental and non-experimental. And then, since when you are carrying out a study, you can either use an experiment or there's no experiment. So we can say, if we are using an experimental, if we are using an experiment for us to find out some numbers that are related to a certain happening. Let's say how many people have been affected by a disease, and then we are using an experiment, that is going to be an experimental study. If there is no experiment, that is going to be observational study. Okay, and then if there is a comparison group, like there's a group that you are comparing to when you are doing your study, then we'll call that as an analytical study. There's no, that is a descriptive study. So this gives you the many categories. You have got experimental studies. So when you talk about quantitative, you have got experimental and observational. It's in observation that you find analytical and descriptive. Now, analytical, you also look at the direction. Sometimes, let's say for example, you have got people that are sick now. You go back in time to find out what made them sick today. Okay, so you can go back in time. You already have the outcome, and then you are going back in time to see what they were exposed to. So that is a case control study. And then you can start with the exposure. So let's say for example you expose people, let's say for example you start following people that are smoking. But for these people, you are going to go with them in time, maybe 20 years from now. You see what is going to happen to them so that you see the outcome. That is now going to be a cohort study. But of course, for a cohort, we can have something that is forward and backward. So we'll talk about those two. Okay. And then when you are dealing with the exposure and outcome at the same time, you call that as a cross-sectional study. So these three are analytical study designs, which are observational in nature. Okay. It's not an experiment. People are already there, and then you are just trying to follow them to see what is happening to them. Hope that's okay. Please, if you are not clear at any point, feel free to be able to ask. So again, we have got experimental study designs and observational study designs. The experimental study design, you have got an active attempt to change some factors. It's an experiment. You want to change some things, okay, to alter the progress of an outcome. Let's say, for example, you are trying to find out the effect of smoking on people. But instead of just you randomly letting people that following people that smoke, and then it can be a bit hard. So you want to expose a certain group to smoking. Okay. Maybe you actually alter yourself, you change some factors so that later on you can see what comes out. So the experimental study can either be randomized control trial or non-randomized control. So you know, you randomization is you just doing something, not that you don't specifically pick people that you want to use. You just get people anyhow, okay, at random. And it's a gold standard when you are doing research. Randomization is a gold standard. Observation, as we said, can either be descriptive or analytical. Descriptive, you describe or measure the characteristics of a specific population. Analytical, you are trying to look for associations between exposure and outcome. This is important. In analytical, there is an outcome. There's also an exposure. I want to see how do these guys relate? Okay. In women, we have got what we call endometrial carcinoma, cancer of the endometrium. If the women that smoke are actually protected against endometrial carcinoma. So you can try to do that experiment. You follow it in time to see the relationship between the exposure and the outcome. Okay. And then let me talk about something common, estrogen. Estrogen causes endometrial carcinoma. It also causes cervical cancer. Okay, actually, it will cause breast cancer. So you see people that get a lot of children, people that have got a lot of children are protected from breast cancer and from endometrial cancer. Same with people that get pregnant early. They are protected from these two types of cancers because when you get pregnant, that time when you are pregnant, you are reducing the amount of estrogen. But it is opposite for cervical cancer. When you have got little estrogen, you're at risk. So you can try to look at those factors. Probably you get some people, expose them to estrogen, and then you follow them in time. That is going to be experimental because there is a change that is there. But when you are just trying to look at the association between an exposure and an outcome, you are not really changing it. You are just looking at it. That is going to be observation, and that's analytical. Hope that's okay. So observational study designs, these ones allow nature to take its course. The investigator will measure but does not intervene. Okay. So you have got descriptive, which is limited to a description of the occurrence of a disease in a population, and is a normally the first step in epidemiological investigation. You are just trying to describe the occurrence of a disease in a population. And then analytical, you go a bit further to look at now the relationship between health status and other variables. You are looking at the outcome and the exposure. Descriptive, okay, so this is how we are dividing. So it was supposed to be observational and experimental. So this descriptive is not supposed to be here. Okay, so the descriptive studies As we said earlier, let me just show you again. So quantitative, you have got descriptive, experimental. So we divide them into these two main groups. Okay, so we are picking each one of them at a time. So the descriptive studies, we of course descriptive is part of the observational. An example is a case report. A case report is a detailed account of a single patient's medical history, diagnosis, treatment, and outcome. Okay. Please take note that it's a single patient. That's a case report. You are looking at one patient. You look at their history, their diagnosis, their condition, their treatment, and also outcomes. So it's going to be used in medical research to document rare or unusual conditions, complications. So what is important about the case report is that it focuses on one patient and it will provide a clinical insight into a rare disease or unexpected treatment outcomes. Let's say, for example, you are giving this patient a certain drug, and then just something that is a bit unexpected comes out, and then you follow this individual patient, okay, to just try to see what would be the problem at that point. So it helps in medical education by sharing unique cases. You actually say, of all people that we gave this drug, only one person has been singled out. This is what they showed of everyone. And then I will start studying that individual person because in their uniqueness. Okay. So examples that we can talk about is previous undescribed disease that you get to see maybe just in an individual person, unexpected link between diseases, unexpected new therapeutic effects just within a person, adverse events. An adverse event, this is a topic in pharmacology by the end. An adverse event is, let's say, for example, someone is taking a drug, isn't it? They are taking a drug and then they end up dying. They are involved in a road accident, they die. That we call it an adverse event because the road traffic accident will not be ascribed to the drug that person is taking. It's different from an adverse reaction. An adverse reaction, these are extensions of the drug's effect. Okay, the drug is supposed to work in your body, but then it goes a bit beyond, or the drug goes in another part of the body where you didn't plan it to go and work, and then it starts to show effects there. So that's a adverse drug reaction. It's different from an event. So what are the advantages of and disadvantages of a case report? A case report will help identify new disease or complication, provide real-world clinical insights, useful for hypothesis generation in medical research, and can guide future studies. The disadvantages is not generalizable because of a small sample size. You are only using a one person, may be subjective and influenced by the author's perspective and lacks a statistical significance compared to larger studies because we're looking at an individual person. So that is a case report. You also have another descriptive study is a case series. Now, case series is a type of medical research study that examines a group instead of an individual person with a similar diagnosis. Let's say, for example, all these people have got cervical cancer. Now you are looking at them, you're trying to examine all of them because they've got a similar diagnosis. And it's often used to assess prevalence, okay, prevalent diseases and can provide valuable insight into a new or unique condition. So experience of a group of patients. Case series focus on a collection of individual cases that share common features, for example, specific treatment or diagnosis. And then you also assess, in case series, you assess the prevalence of a disease, okay, to understand how much frequent is a disease and also the characteristics of a disease within a particular population because all these people that you are trying to study have got the same condition. So now you are trying to look at all of them and seeing their characteristics which are similar. So of importance is case series, you are looking at multiple cases. Case report is only one case. Okay. Another thing that is unique about case series is that is identification from single or multiple sources. So patient in a case may be identified from a single hospital, clinic, or multiple sources, depending on the scope of the study. So you can pick patients from a lot of places as long as they've got the same condition, and then you can now study them. Okay. So take note that this is a descriptive study, it's not experimental, because we do not include control groups. In experimental studies, you normally include control, like you are studying one population, but there's also another population that is not exposed that you are trying to look at, so that you compare those that are exposed, those are not that are not exposed. Okay, and then you compare the results. Advantages: it will allow for comparative analysis across multiple cases. You can compare cases and can highlight emerging trends in medical condition, provide valuable primary data for large studies, and you can generalize it, because at least you are dealing with a lot of people. So you can say, okay, the results that you found out from all these people, we can actually make a conclusion. This might be the case for everyone else that might have this condition. Disadvantages: still lacks statistical power, because it's still it's still small compared to controlled studies which are experimental in nature, because this one is descriptive. The findings also may be biased because of the absence of a control group. Control is very important to avoid biasness, and then you cannot establish causal relationship, only associations. So you not know what really causes the cause of this condition, but you're only looking at the association. What is associated with this condition? For example, everyone that you are dealing with has got a condition. So you just be basically looking at, okay, this thing is happening in this one person, it's also happening in this person, or probably they are associated to this condition. So that was the descriptive study. Okay. And then we have got an analytic study. Remember, descriptive and analytic, both of them are examples of observational. In analytical studies, we have got experimental studies. Actually, the experimental studies, these guys are supposed to fall in their own group. As we said, the experimental is alone, and then observation. Analytical is alone. But now, sometimes the way these are put, you are going to see for for the analytical studies, again, they will say experimental and observational falls under analytical. So in this case, that's how we are discussing it at this point. Analytical, you have got experimental and observation. But earlier on, we said we can also divide them into those two big categories. So experimental studies involve controlled experiment or controlled environment, where researchers will actively manipulate variables to observe their effect. So the experimental studies, as we said earlier, you have got randomized control, and then you have got community trials. The randomized control, the participants are randomly assigned to treatment or control groups. Okay, you get these participants, you treat them, or the control groups. So you want to test to see the effect of the intervention. You have got a group, and then you say, okay, let's give these people a certain drug, and then now you want to see what to be the effect of that drug on those people. Okay, community trial is just conducted at a larger scale. It's also similar to randomized control. It's an experiment, but you are doing it at a larger scale. For example, you want to see the effect of a vaccine. So again, randomized control trial, which is an example of experimental. This one is a design with the subjects randomly assigned to treatment and comparison groups. Of importance is provides most convincing evidence of relationship between exposure and effect. It's a gold standard. Randomized control is a gold standard of research. Take note of that. Last year's test one, it just came like that. The following is a gold standard for research, and then they gave those multiple choice. Okay. So what will be happening in an experimental study design, you have got your study population, you have got the intervention, and then you have got the control group. In, and then you are trying now to see the outcome in the intervention and in the control group. So you start at as a certain point, and then you are following the those people that you have changed something. Okay, like let's say for example, you get two groups of people. One group, you give them a certain drug. Another group, you just let them be. And then now you are following them over time to see what is going to happen to both of them. Okay? Some of those that have got the intervention, those that you give the drug might get a certain disease that you're trying to follow. Some of them might not get, including also those controls would you didn't subject to the drug that you are trying to test or something that you're trying to study. Some of them can have the disease, others will not have the disease. Okay, so that's how you go in time. Disadvantage is that it is expensive, not appropriate to answer certain types of question. It may be unethical, for example, to assign persons to certain treatment or comparison group. Might not be ethical. And then observational studies, unlike experimental ones, these ones do not involve direct intervention. Okay, you are just following them. There is no direct intervention. And in observational studies, here we have got cross-sectional studies, cohort studies, and the case control studies. But remember the way we classified it earlier, we said the observational ones we have got, that's where I've got the analytical, and then the analytical, that's the one that we can have cross-sectional studies, cohort, and case control. Basically the same, nothing different there. So in a cross-sectional study, you collect data at a single point in time to examine association. Okay, for example, surveying dietary habits and obesity rates. So you see here you are looking at the exposure and the outcome at the same time. You look at people that are obese, and then you are also looking at the food that they eat. So you are looking at the exposure and the outcome at the same time. That is cross section. And please, it's important for you to know this is happening at a single point in time. Cohort studies, you follow a group of individuals over time to assess the risk and outcome. For example, you track smokers and non-smokers to see the development of lung cancer. In a case control, you compare individuals with a condition to those without a condition to identify potential causes. For example, you want to investigate risk factors for a rare disease. That is a case control. Okay, people already have the disease, you're comparing them to those without the disease so that you see the risk factors. So a cross-sectional study is observational in nature, remember, and it's analytical. Okay, you look at it, surveys the exposure and disease status at a single point in time. So we're just looking at a point in time. Cross-sectional studies, they measure prevalence. What is prevalence? Prevalence is the number of people that have got the disease or the number of people that are affected. So prevalence, you don't include people that have recovered, you don't include people that are dead, you only look at people that have got the condition. Okay. At a specific point in time. So I'm going to have your sample, you look at those that are positive and those that are negative, and then you look at if those that are positive, were they exposed or not exposed? Those that have got the disease, or those which are negative, were they exposed or not exposed? And then you can come up with a table like that. Okay, so that is a cross-sectional study. And then you have got a cohort study. So for a cohort, it's also observational study, but you compare individuals with a known risk factor or exposure with others without the risk factor or the exposure. So you are looking for a difference in the risk, that is the incidence of a disease over time. It's a based observational design, the cohort. Okay, so you collect data. Normally you collect it prospectively or retrospectively. You can follow people in time or you can go back. So for a cohort study, you have got, you can divide the cohort. You can divide into retrospective, the one that you are going to be going back in time, and then the one that you are going forward in time. So, so a prospective, that is following people in time, you look forward, okay? Look to the future, examine future events, follow a condition, concern, or disease into the future. For example, you start your study today, and then you are looking at people that have got a certain exposure or a certain risk factor, and then now you are following them in time to see if later on in time they are going to develop a certain condition because they've been exposed. Okay, they have got a risk or the exposure, and then you follow them in time to see the outcome. That is prospective. So you measure exposure and the confound the variables. You look at the outcome in both the exposed and the non-exposed. A retrospective study, retro is going backwards. You look back in time to study events that have already occurred. For example, you look at people that have got lung cancer and people that do not have lung cancer. You go back in time. These people that have got lung cancer, did they used to smoke back in time? You start asking them maybe about 20 years ago. Some of them might have forgotten that they even used to smoke. And then you follow the people that don't have lung cancer. Also, you go back in time to see if they were also exposed. That is retrospective. Again, what is important for you to know is when you look at the people that are exposed and the people that are not exposed. Now, for the people that are exposed, you look at how many of them have got the disease. For example, these are exposed, they smoke. How many of them have got lung cancer? How many of them don't have lung cancer? And then those are not exposed, those that don't smoke. How many of them have got lung cancer? And how many of them don't have lung cancer? So I've got the exposed with the disease, the exposed without the disease, the exposed, the non-exposed with the disease, and the non-exposed without the disease. So you can look at the incidence in the exposed and the incidence in the non-exposed. So incidence in the exposed is going to be the number of people that have been exposed and they've got the disease divided by the total number of people that have been exposed, whether they've got the disease or not. That is the incidence of the exposed. And then the incidence of the non-exposed is the number of people that have got the disease but they are not exposed, divided by the total number of people that are not exposed. That is the incidence of the non-exposed. And then when you divide the incidence of exposed divided by the incidence of the non-exposed, that is going to give you what we call the relative risk. For example, you have got here, okay? You have got smokers and then you have got non-smokers. You have got those that have got the disease and those that don't have the disease. So if you want to find the incidence in smokers, you look at how many smokers have got the disease. There are 84. How many people in total smoke? You have got 3,000. So the incidence in smokers will be 0.028. And then the incidence in non-smokers, you look at the non-smokers that have got the disease, they are 87. And then you look at the total number of non-smokers, and those are 5,000. So the incidence in non-smokers is 0.017. So you can see the incidence in smokers is higher than the incidence in non-smokers, meaning that if people smoke, they are more at risk than people that don't smoke. But now you want to compare these two values. Is it significant? Is there a significant difference between people that smoke and people that don't smoke in developing the disease? So that's when you calculate the relative risk. So relative risk is the outcome rate in the exposed divided by the outcome rate in the non-exposed. So if you have got a relative risk of 1, it means that there is no difference between those that smoke and those that don't smoke. So both of them can develop the disease equally. If the relative risk is greater than 1, it means that the exposed are more at risk of developing a disease. If the relative risk is less than 1, it means that exposure, if you're exposed to the factor or to your risk factor, you are low in developing the disease. For example, people that exposed to people that smoke are protected from endometrial carcinoma. So it means that the relative risk in that case is going to be less than 1. So if you compare people that smoke and people that don't smoke, those that don't smoke will have got a higher chance of developing endometrial cancer than those that don't smoke. So the relative risk is going to be less than 1. Okay. Including also vaccination. People that are vaccinated, they've been exposed to the vaccine, are going to be at a reduced risk of developing a certain disease in comparison to people that are not exposed. So if a relative risk, let's say you calculate your relative risk and you find that it's 1.3, what does it mean? So if you find the relative risk of 1.3, you are going to get the relative risk. You remove a 1 and then multiply by 100. It means that there is a third, because the relative risk is greater than 1. Okay? If it's greater than 1, you subtract 1 from that relative risk and then you multiply by 100. In this case, it means that 30%, there is a 30% greater probability of people that smoke or people that have been exposed to developing that disease than people that are not exposed. I hope that is okay. That's clear. All right. So, what are the advantages and disadvantages of a ca- of a cohort study? So, a cohort, the strength is that the exposure status is determined before disease detection. So, you first know the exposure before you can detect. The subjects are selected before disease detection. So, select the subjects and then now you can detect the disease. And then the case study has got several outcomes for each exposure. The limitation is that it is expensive and time consuming, because this is specifically the prospective, because of following them in time, it is expensive. And then it is inefficient for rare diseases, because imagine you start following people in time, they will end up dying and you will not find out about the what you wanted to complete. You will not be able to complete your study because your subject would have died in the way. Okay, they can also be loss of follow-up, because sometimes the people, let's say have been following people for 20 years, some of them they can just get tired and they'll just tell you, no, we are tired, I'll no longer be part of this study, and you can't force them because you have got research ethics. You don't force people into the research that you are doing. Okay, so that is a cohort. So we've talked about what? We've talked about a cross-sectional study where you study the outcome and the risk at the same time, and we've talked about a cohort that can either be prospective or retrospective. And then you also have a case control. Case control is also observational. Here there is exposure data that is collected going backwards. So case control is similar to the cohort that is retrospective. You are also going backward. Okay, and it's the most feasible design where disease outcomes are rare. So here, what happens is that you start, people have got a disease, and then you are going back in time to see the effect. Okay, so you start somewhere, the present time now, you see, okay, these people are sick. You go back in time. What were they exposed to? Okay, what factors were they exposed to for them to have this condition? So the strength or the advantages of this study is that it is less expensive and time consuming, because you just ask people, and it is efficient for studying rare diseases. Limitations is inappropriate when disease outcome for a specific exposure is not known at the start of study. Exposure measurements taken after disease occurrence. Disease status can influence selection of subjects. So some limitations is that the exposure measurement is taken after the disease has already occurred. So someone is already sick, and then now you go back to look at the exposure. Some of them might not even remember what they were exposed to, unless you really know what you're trying to study yourself. So those were quantitative study designs. I hope you can list the quantitative study designs. We are saying they can either be experimental or observational. Experimental, I've got the randomized control or community control, or randomized control trial or community trial. The experimental, you have got the analytical there and the descriptive. The analytical, you have got the case control, you have got the retrospective and the cross-sectional study. You should be able to list them. I hope that's okay. All right. And then we have got qualitative research designs. Qualitative aim to explore and understand the complex phenomena. So here there is depth, descriptive analysis of numerical data. Okay. So here you are trying now to describe more in detail, not numerical data, but non-numerical data. And the common ones you have got phenomenology, ethnography, grounded theory, case studies, and narrative inquiry. So these designs allow researchers to dive into the meaning and context of human experience, behavior, and social interactions. So these are the qualitative study designs: grounded theory, case studies, not case control. Case control was in the other one. Okay, case studies, historical, phenomenological, ethnographic, narrative. Last year's test asked give 5 qualitative study design as an essay. So what is phenomenology? Phenomenology is you trying to describe the meaning of the lived experience about a concept or phenomenon for several individuals. It's important for you to know that it's lived experience. So you can't use this study design if you're not ready to stay with people. So you as a researcher, you are going to go in a place, you start staying with people, okay? For you to gain a deep understanding of the phenomenon by rigorous systemic examination of it. Okay, so its purpose is to describe the essence of lived experiences. So in here, you describe the structure of experience as they present themselves to consciousness without resources to theory, deduction, or assumption from other discipline. You are basically going there. You stay with people so that what they feel, you are able to feel it also. That is phenomenology. The advantage is it provides deep insight into human experience because you are also experiencing that. It captures subjective meanings and emotion. You know, majority of the things that we think is true is subjective. For example, the way you are going to take a heartbreak for you, the experience is so different from the next person. It's subjective. It depends on the person. So phenomenology will capture subjective meanings and emotions. It will also help understand complex psychological and social phenomena. The demerits is the findings are highly subjective because it also depends on you as the researcher, how you feel, how you take it, and it's difficult to generalize. It requires intensive data collection and analysis and can be challenging to interpret due to personal biases, d- uh, depending on how you feel yourself. Ethnographic involves immersing into a cultural or social group to study behavior, traditions, and interactions. Researchers often spend extended periods, so you can see again ethnographic. You want to study culture of people, but you don't want to study this culture of people by listening to them. You are going to stay with them, okay? Like phenomenology, where you are studying lived experiences. You might not, let's say you want to study people that have got let's say cancer. You shouldn't have cancer also, but you can just be looking at these people, how they live their experiences, the people with cancer, or they tell you more about just their experience, the way they've lived for phenomenology. But of importance in ethnography is want to understand the culture of people, and you end up staying with them for you to understand the culture that they have. Okay? So different from phenomenology where people can tell you about how their experience, how they've lived with that condition. For ethnographic, it's more now you understanding a culture by you being part of the culture. You might not be part of the disease, but you being part of the culture. Okay. So I've got macro ethnography and micro ethnography. Macro is researchers can study broadly defined culture in what is sometimes referred to as macro ethnography. For example, the British, the English, so you are studying really broadly defined culture, something that is big that a lot of people do. Advantages: it will offer a rich contextual understanding of culture and social groups, uses the real world observations, making findings highly authentic, allows for long term engagement because we'll be staying with people. Disadvantages is time consuming. Imagine you for you to understand the culture, you stay with people for 20 years. Okay. There is risk of researcher bias because of immersion in the culture, and then an ethical concerns related to privacy and consent can come in. And then grounded theory. Grounded theory aims to develop theories based on data collected from participants rather than relying on existing theories. There are a lot of theories that are there, but we don't care about that. We want to collect data from the participants. So researchers continuously analyze data and refine their understanding as patterns emerge. So uses constant comparison to refine theories. You're always comparing what you found with new ones, okay, to make new theories. So data collection and analysis will be occurring at the same time in grounded theory. You get your data, you analyze it, you find out what really is happening in this community or with this population. So it results in a new theoretical framework. Example, developing a theory on how employees adapt to remote work. You'll be talking to the employees themselves and not what others told you beforehand. Advantages: develop new theories based on real world data, uses systemic coding, making findings structured and reliable, allows for continuous refinement because you're always changing the findings because you're not relying on what was found out the previous time. Disadvantages is that it requires a large amount of data for theory development, can be complex and time intensive, risk of overgeneralization if not properly validated. A case study provides an in-depth analysis of a single case. Okay, case study, single case to understand complex issues. So they are useful for exploring unique or rare phenomena and uses multiple data sources, for example, in interviews, documents, observations. And a case report, when you're trying to understand the complex, a single case to understand the complex issue can be exploratory, descriptive, or explanatory. For example, you can investigate how a small business survived an economic crisis. So you get just a single case, and then there's this big complex issue that we are trying to study. So basically, this is it about research designs. Okay, just a question. Which of the following study design is a qualitative research method? Cross-sectional, cohort, embedded, phenomenology. So you can see it is, isn't it? There's also a question that I didn't include, which was asking about the gold standard for a research. So the gold standard for research is the randomized control. And then there was an essay question for 5 marks. Name 5 study designs used in qualitative research. Just to name them, just 5. Okay. We've talked about case study, ethnography, phenomenology, grounded theory. There is a narrative. Okay, just a moment. Sorry for that. Can you see the screen now? Okay, sorry for that, guys. Are you able to see the screen? Okay. So yeah, so there's that question, name five study designs used in qualitative research. So you can name any five. We've discussed the qualitative research study designs. And then, so that was section B, short answers. And then section C, there were a lot of questions. So I've gotten this one on the part that we've talked about. So there was this question for section. So the research paper, you have got multiple choice questions. They came 50, they brought 50 of them the other year. And then section B had like, is it three questions? You answer all of them, one from biostatistics, one from research, one from epidemiology. You answer all of them. And then section C also, there were like five questions. Yeah, should be six. You choose one. You answer two were to be answered without choice, and then for the other three you choose now. Okay, so this was one of the questions, 10 marks. The results from one study were obtained as shown. You have got smoker and then non-smoker. Those that are smokers and they are positive for this disease, they are 84, and then the non-smokers 80, which are positive, 87. Smokers and then they are negative is 2,916. Smokers and the non-smokers are negative 4,913. Said calculate the incidence for smokers and non-smokers. Remember the incidence for smokers, you get the number of smokers with the disease 84 divided by the total number of smokers 84 plus 2,916. That will give you 3,000. So 84 over 3,000, that will give you 0.028. And then the incidence for non-smokers, you get the non-smokers that have got the disease 87 divided by 87, the total number of non-smokers 87 plus 4,913, that gives you a 5,000. So 87 over 5,000, that will give you 0.0174. Question B was saying what is the relative risk? So relative risk is you get the incidence of the smokers, you divide by the incidence of the non-smokers. That will give you 1.61. And then C was saying in one sentence, interpret your results in B. So what does this incident relative risk mean? So if you have got a relative risk of 1.61, what you do is, since it's greater than 1, it means that there is a higher risk of the cancer developing in smokers than there is the chance of developing in non-smokers. So you can say 1.61 minus 1 and then you multiply by 100, you'll get 61%. So there is 61% chance that smokers will develop cancer than non-smokers. D was saying if someone asks you how to interpret the relative risk results, write down what you would say to him or her. So relative risk tells us how much more likely it is for one group which is exposed to develop a certain outcome compared to another group which have not been exposed. Relative risk of one means both groups have got the same risk. Relative risk greater than one means that the first group which have got exposure are at a higher risk, and then a relative risk that is less than one means that those that have been exposed are actually protected, okay, or they are at a reduced risk of developing the disease. So that is it.